Medicare Advantage plans are everywhere. Ads show $0 monthly premiums, dental, vision, hearing, even gym memberships. But here's the truth many agents don't say aloud. Medicare Advantage plans are not for everyone. So in today's video, let's talk about the 3 types of people who absolutely should not enroll in a Medicare Advantage plan, and discuss why Original Medicare and a Medigap plan may be a better fit. So if you or someone you love is about to enroll in Medicare or currently enrolled in Medicare, don't miss today's video. But first, a brief refresher as to what exactly a Medicare Advantage plan is. Now, if you're already a pro and you don't need to hear me describe it again, then feel free to check out the video chapters in the description below and jump ahead. Alright, so Medicare Advantage is an alternative to Original Medicare. Medicare Advantage plans are offered by private carriers, but they must offer at least the same benefits as Original Medicare, which is Part A, your hospital insurance, and Part B, your medical insurance. Now, very often, these types of plans will offer additional benefits as well to entice beneficiaries. Most frequently, these would be prescription, vision, dental, and hearing benefits. However, many plans choose to offer additional benefits as well, even things like gym, transportation, etc. Now, there is some fine print here. Medicare Advantage plans operate on networks, either HMOs or PPOs. Now true, PPOs will give you much more flexibility than HMOs, but still nowhere near as much flexibility as Original Medicare. Also with Medicare Advantage plans come the issue of pre-authorization. These are managed care plans. That means that between you and your doctor and the services or treatment that they're recommending stands your insurance carrier. They must first approve these treatments or services. And this can be quite a headache for some people. First, and this one may be tough to hear, if you are currently undergoing treatment or soon to begin treatment for cancer, then Medicare Advantage is probably not right for you. Most Medicare Advantage plans require you to pay 20% of chemotherapy or infusion costs out of pocket. That continues until you reach the plan's out-of-pocket maximum, which can be thousands of dollars. Now, chemotherapy costs could be $10,000 per treatment cycle. If you pay 20%, that's $2,000 per treatment. And over several treatments, those costs really stack up. Even with a $0 monthly premium, your annual costs would be staggering. There's also coverage restrictions. Medicare Advantage often limits which oncologists or hospitals you see. Your preferred cancer center might be out of network, meaning you pay full price. And if you're experiencing a severe medical crisis, you need to be able to see the doctor that you want to see. Now, alternatively, with Original Medicare and a Medigap plan, you would have predictable costs, likely covering your out-of-pocket costs for chemotherapy, and of course allow you the full access to all doctors and hospitals who accept Original Medicare, and almost all do. Also, if you are a person who takes high-cost medications or infusion medications, then a Medicare Advantage plan may not be ideal for you. People who take high-cost medications, especially injections or infusions like biologics, certain rheumatoid arthritis medications, or chemotherapy drugs, as we've discussed, may not look to a Medicare Advantage plan as their ideal option. Very often, these are the types of medications that would be covered under Medicare Part B. Most medications would be covered under Medicare Part D, but there are some limited exceptions, these being the point in case. And as we've just discussed with chemotherapy, you would have a 20% coinsurance, and that can certainly stack up, as we've already seen. For example, if you need an infusion that costs $5,000 every month, that 20% coinsurance would be $1,000 per month. Over a year, that's $12,000 in out-of-pocket expenses, even if your plan has a $0 monthly premium. So if you're new to Medicare, you could again choose to enroll in Original Medicare plus a Medigap plan to alleviate the issue of network restrictions and also handle that coinsurance. Now I want to get back to what I mentioned earlier, which is the issue of pre-authorization, also known as prior authorization. Very often when you're looking at a Medicare Advantage plan, you'll see limits apply when looking at certain benefits. That's because your Medicare Advantage plan requires pre-authorization. That means that between you and your doctor and the treatment they've recommended stands your insurance carrier. They will first need to pre-approve this treatment. This can lead to delays, a lot of paperwork, possibly even denials. And in the case of life-saving medication, this is absolutely not something that you want to be involved in. Now, very often you can circumvent this by submitting the proper paperwork, but again, this will lead to delays in care, and it's just a headache. And if you're already experiencing some type of medical crisis, this is not the added stress that you need in this moment. Now, I will say, there have recently been some legislative changes that are supposed to help with the issue of pre-authorization for Medicare Advantage beneficiaries. It's supposed to expedite the timeline and improve transparency, so hopefully we will see this come to fruition, and if that's the case, then the issue of pre-authorization may be something that we're seeing less and less of in the future. Now, a quick pause here. If you're someone who's experienced this pre-authorization roadblock, let us know in the comments below. Did you find this issue easy to circumvent, or was it very difficult to navigate? We'd love to hear from you. Also, if you have questions about Medicare Advantage, Medicare in general, or just health insurance in general, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers, we're licensed nationwide, and there's absolutely no charge for our services. And regardless of which Medicare path you choose, we are more than happy to help. Also, we do release these videos on a weekly basis, so please make sure to subscribe to stay up to date. There have been a lot of changes to Medicare recently, and we anticipate a lot more to come. And of course, please make sure to like this video so we can get this information out there. All right, let's get back to it. And last but not least, the last type of person who should probably avoid a Medicare Advantage plan is someone who likes to travel frequently. Medicare Advantage plans do tend to have more regional networks, so you will be restricted in your access of care except in the case of a true medical emergency. If you're out of the area and you have a medical emergency, please go to the hospital and it will still be covered. You do need to receive emergency medical care if you need it. Now, that being said, again, there are limited provider networks, especially when we're talking about HMOs. You will have much more flexibility with PPOs, but that's going to come with higher out-of-pocket costs. So if you are a snowbird or someone who likes to travel frequently, a Medicare Advantage plan may make your life a little bit more difficult. If you need routine care like checkups, lab work, or follow-ups, and you're out of your regional network, then that's going to mean big bills. Or at the very least, you're going to have to plan things a lot more carefully to make sure that you're at your home base when you need that routine care. Now, alternatively, with Original Medicare plus a Medicare supplement plan, you can go anywhere that accepts Original Medicare, and almost all do. That means you can travel frequently, with ease, without concern of having regular access to medical care when needed. There are even some travel benefits should you choose to travel internationally. So, a quick recap. You should rethink Medicare Advantage if you're actively undergoing cancer treatment, if you take expensive injections or infusion medication regularly, or if you travel frequently or split your time across states. Now, if this is the case, we highly recommend that you check out Original Medicare plus a Medicare supplement plan. There are many different plans to choose from, however, the benefits are standardized. So basically, if you choose Plan G, the benefits are going to be same regardless of who the carrier is. You do need to pick a carrier with a history of low, more stable rate increases. If you want to learn more about Medicare supplement plans, I'll put this video over here so you can learn a little bit more. I'll also make sure to include our All About Medicare playlist. As I mentioned earlier, if you have any questions or concerns, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers, we're licensed nationwide, and there's no charge for our services. And before you go, don't forget to like and subscribe. We'll see you next time.